Ontario announced a funding increase for long-term care homes. Premier Doug Ford says this funding will help build thousands of beds for residents. Ford says the province will commit to building 30,000 long-term care beds over the next 10 years. He also announced a $1.75 billion investment to kickstart the development. And this will help create 8,000 new beds and 12,000 redeveloped beds. Joining me now in Toronto is Pat Armstrong. She is a distinguished research professor at sociology at York University. She also led the 10-year international project called Reimagining Long-Term Residential Care. Pat, welcome back to the program.
Thank you.
All right, what do you make of Doug Ford's funding increase?
Well, I think that it's not going to do much right now for the issues in front of us. It would be good if we got air conditioning both for the residents and for the people who provide the care, especially when they're all dressed up in these COVID protective outfits. But it's not doing anything about the major issues that were identified in the military report and that study after study has revealed year after year after year. Staffing is absolutely critical, and there's nothing I can see in this funding that talks directly about staffing. It does talk about 4 bedrooms, and it would be a good idea to get rid of those. But if you read the military reports, they don't focus on 4 bedrooms. They talk about food, they talk about cleaning, and they talk about staffing. Those are the issues.
Is it not, I want to break down those issues in a moment, but is it not like the hospital system where you assign new beds, you also have to assign somebody to look after the people in those beds?
Well, you would think so, but when we look at the quite different staffing levels in the homes in Ontario, the lowest staffing levels are in the for-profits, according to the data we have right now anyway. The somewhat more in the not-for-profits and the most in the municipal, but none of them reach the minimum of 4 hours of nursing care per resident per day that was established in research over a decade ago. And the recent research I've seen by Charlene Harrington, who's an international expert on this, is suggesting that if we're talking about the kinds of residents we have now in long-term care, we should be talking about something like 6 hours of nursing care per resident per day. And there's nothing in this announcement in terms of staffing levels.
Is there anyone in Canada who has that model where 6 hours of nursing per resident occurs?
No, but the City of Toronto has said that they're moving to 4 hours, which is an improvement for sure. And we could at least do that now. And that could be a step in the right direction.
Talk to me about the issues with food.
Well, in our international study, we were looking for promising practices. And one of the things that we saw as being absolutely critical in long-term care is food, not just in terms of do you get the right nutrition, but of course that's important. And again, in the military reports, we saw that that wasn't happening. But it's also about, it's the main event of the day that people, as they get older, are less interested in eating. So you have to tempt them. You have to pay attention to what kinds of things they're offered, but also you have to spend time with them in terms of eating. It's skilled work to help people who have difficulty swallowing or have other kinds of issues with food. So it deserves a lot of attention. And in recent years, we've talked about these as ancillary services that aren't anything to do with healthcare, but indeed they are central to healthcare. And unless we have food cooked on the premises, made in quantities that appeal to the older people who are in those residents, and it has the kind of food that they want and the kind of variety they want, they're going to suffer from malnutrition. And we certainly saw indications of that in the military reports.
Yeah, we sure did. So looking at this, $1.75 billion over the next 5 years to invest in long-term care homes, a redesigned funding model, looking at private, semi-private rooms, new design standards to include air conditioning. Isn't that a good start?
Well, let's see the details about how those are going to be assigned, who's going to be building them, what kind of role is profit going to play, how are they going to decide who gets this money to do what with, and what kind of reporting are we going to get on how that money is spent? Not just from the government, but from those who are actually given those beds. I think we have a lot of evidence coming out of this that have to do with the difference between for-profit and not-for-profit. Now, again, it's not to say that all for-profits are bad or that all not-for-profits or municipal homes are good, but these are patterns that we've had for a while. And 4 of the 5 homes that the military went into initially were for-profit, and 1 was a not-for-profit. So I think we have to pay attention to where is getting these beds, where they're going to be built, and under what conditions.
Yeah, and inspections would go a long way as well, I imagine.
Absolutely, but we can start by deciding before we even hand out the money for these beds who they're going to go to on what basis.
Pat, thank you once again.
Thank you.
Pat
Let's hope we can keep this topic.
Oh, I'm sure it'll be around for a while. Pat Armstrong is a distinguished research professor of sociology at York University.